Good day, everyone. You're welcome to SmartSpark Academy. If today is your first time of coming across this channel, please like, subscribe, comment, and share with your friends. We'll be looking at a very important anatomy topic, which is cubital fossa. Now, these are for my anatomy babies that are reading to pass their exams. We are going to learn this topic using exam marking scheme. Under this cubital fossa, I'll be looking at the description, the location, the boundaries, content of the cubital fossa, and finally, clinical importance. Diagram to be attached because you know in anatomy, when you're writing the exam, you must give diagrams for extra mark. So please, if this is what you're looking for, hold on and watch to the So first things first, let's look at the description of the cubital fossa. Now, I want you to understand that the cubital fossa is a triangular space present in the anterior aspect of the arm. Now, this is a very simple diagram. This is the anterior aspect of the arm. We all know when your palms are open anteriorly. Now, it is present here at the junction between the arm and the forearm. It's a triangle. I think it should be around here. Yes. Now it's a triangle present at the junction between the arm and the forearm. Now the location, like I've mentioned already, is at the junction between the arm and the forearm. So when you stretch your arms with your palms open, this place here is where you can find the cubital fossa. With that, we look at the boundary. The medial boundary of the cubital fossa is formed by the pronator teres muscle. Please don't forget medial pronator teres, and the lateral is formed by the brachioradialis muscle. Don't forget medial pronator teres, lateral brachioradialis. Now, the roof of the cubital fossa, like what covers the cubital fossa, is the skin, the superficial fascia and the deep fascia, which is reinforced by the bicipital aponeurosis. Now, someone would ask, what's this bicipital aponeurosis? Now, the bicipital aponeurosis is formed by the medial and lateral cutaneous nerve of the forearm and the medial cubital vein. Please don't forget medial and lateral cutaneous nerve of the forearm and the medial cubital vein. Now, look at the floor. The floor of the cubital fossa. What does it rest on? Remember, we've talked about the roof, what covers. Now we're looking at the floor, what it rests on. Now, the floor of the cubital fossa is formed by two muscles. We have the supinator muscle medially and the brachialis muscle laterally. So with that, on the boundaries, I made mention of our base, our apex, the medial boundary, lateral boundary, the floor, and the roof. That's that on boundaries. I hope we are good with that. Now we are going to look at the contents. What can we find in this cubital fossa? What are those important things that make up this cubital fossa? Now, there's a very interesting mnemonic I want us to learn so we can easily remember it and remember the contents of the cubital fossa. Is very simple. My brother throws red parties for ladies. Please say it with me. My brother throws red party for ladies. Now, on the contents of the cubital fossa, I remember I mentioned the mnemonic. My brother throws red parties for ladies. Now, with this, we easily remember what the cubital fossa holds. The first, my M, we have the median nerve. Now, this median should ring in your memory and make you remember that this starts from medial to lateral. Like this content now, what I'm mentioning from the medial boundary to the lateral boundary. So this is medial to lateral. So all these structures are arranged or positioned in the cubital fossa from medial to lateral, median, medial. Just remember, that is how I remember to my last anatomy exam. Please know that this question came out my first semester 200 level anatomy exam. Now, my median nerve, brother B, brachial artery, throws, tendons of the bicep brachial muscle, red R, radial nerve, parties, posterior interosseous nerve, 4 F, fat, ladies L, lymph node. So with this, Maybe you mentioned this, your lecturers know that you know what you're talking about. You know what they want. So you've mentioned you've given your description, you've given your location, you've given boundaries and content, and there's an image attached. You give this diagram. Trust me, you're literally getting 10 over 10 already. Now we are going to talk about the clinical importance of this cubital fossa. So now we are going to talk about the clinical importance of this cubital fossa. Why is it an important aspect in anatomy? Now, now on the clinical importance of the cubital fossa, we have venipuncture. Now, this is piercing the vein to get blood. The cubital fossa is a very important anatomical landmark in that venipuncture can be done here. The second one is the brachial artery pulse can be felt. We have radial artery, we have brachial artery. Most times if you want to check pulse, we check with the radial artery. But now there are times we also use the brachial artery to check the pulse. Now this brachial artery, remember that the brachial artery is the second medial content of the cubital fossa, brachial artery. Now the brachial artery pulse can be felt. You can do it yourself. Just put your hands on your cubital fossa and feel it. You feel like beating. Yes. Now the brachial artery pulse can be felt. And number three, which is my last important. So number three, which is my final clinical importance. Now this cubital fossa is an important landmark during trauma assessment or elbow injury. Now, if you have an injury and you go to the hospital, like you have an injury around your elbow region, the first place they will check is your cubital fossa to ensure that none of the contents have been ruptured or was disturbed. Go on with your anatomy textbook, you see more clinical importance. I've just given you the three major importance. Go on, read wide. With this video now, if you open your textbook or the notes given to you, trust me, you will understand. Just remember description, location, boundaries, content, and clinical importance, and you're good to go. We've come to the end of this lecture. Please don't forget to like, subscribe, drop a comment. If you have any question, please ask, and we are always ready here at SmartSpark to answer and share to your friends. We have other videos on our channel. You can scroll, look for the one you like and watch. Thank you very much.